So first and foremost, what is digital epidemiology?
Well, I see digital epidemiology as the age-old epidemiology, the study of diseases in populations, but using digital data sources. And I think if I kind of list those, the sort of sources that I'm interested in are the use of electronic health records, both from primary and secondary care, and other linked data, the use of consumer technology such as smartphones and smartwatches, other sensor data, social media data where people are sharing their experiences of health, as well as the digital traces that we all leave behind in our day-to-day lives.
And what uses of digital epidemiology do you see clinically for patients?
Well, what we've been talking about today is about medication safety. So my research began by looking at a national drug safety register, looking at the safety of biologic therapy. And within that, I saw there were examples of where we could do with information collected either in a different way or different types of data. And that took me down this route of digital epidemiology. We need to know what medications are being prescribed, both in primary and secondary care. We need to know whether the patients take those drugs or not. We then need to know the outcomes in terms of did the drug work. We need to know whether the patient's got side effects. Again, those side effects that might take them to the GP or to the hospital, or even that they just experienced at home. And then we also need to measure and put into the analysis the confounders, the things that might mix up the relationship that we see between the drug exposure and the benefits or harms of treatment.
And what challenges do you see for collecting this type of data for patient use?
Well, there's innumerable challenges, really. We need to make sure that the quality of data is good. We need to understand the populations. Are there selection biases in who uses this information? Are there selection biases out of the study? People engage initially but then drop out. Are those people who drop out in some way different from those who stay in? We could go on for a very long time about the challenges, and it kind of depends upon what problem you're trying to solve with.
And do you see an increase in social media platforms such as Twitter and Facebook being useful for clinicians, or working against kind of identifying common themes or medication kind of errors or problems?
I think for population health research, we need to work out where it fits. I think when people started looking at social media as a source of medication safety, we thought that we'd be detecting new adverse drug reactions. That seems less likely now, but I think where people are sharing their experiences, we'll learn a lot about what matters to patients. I think that's likely to be where we learn a lot.
What top tips can you give for clinicians who work with the type of research you're doing for filling out case report or case records forms to help inform you guys make better decisions with the data you have?
I mean, I think we probably need to change some of the systems that we have for collecting data in the first place. We need to think really carefully about what the different uses of that data are and try and align what we need for clinical care, for what we need for research, for what we need for regulation, for audit and revalidation, and many other purposes. But actually, those different purposes overlap significantly. Let's design the clinical system so that the data are fit for purpose for many other things as well. It's a real challenge, but one that I think we